I'm Luke Hart of the Middletown Health Department, and this is Healthline. On this edition, when the COVID-19 pandemic began, Connecticut was hit pretty hard, but now our state is faring better than most others at this time. However, is there a second wave coming as flu season approaches? Dr. Alina Filozov is here to give us an update about COVID-19 and explains how you can protect yourself and others from being infected, what to do if you suspect that you've been infected, and how long it may take for a safe and effective vaccine to be developed. Welcome to Healthline. Our guest today is Dr. Alina Filozov. Dr. Filozov is the Chief of Infectious Diseases with Middlesex Health. She's also the Middlesex Hospital's Chief Epidemiologist. And Dr. Filozov, welcome to our program.
Thank you, Lou. Thank you. Good morning, everyone.
Let's talk a little bit about it. It's August right now. This show will air in September. Connecticut's in pretty good shape as COVID-19 goes. What do you think is upcoming with the flu season? What can we expect?
You are correct. Connecticut is in excellent shape, and we would like to keep it that way. But of course, every time the flu season comes in, there is an increase in flu-like illness, whether it's flu or other viruses, and now in the mix is COVID. And the difficulty is that people may be early on developing very similar symptoms, and it's going to be very hard to distinguish. Are you having a regular little cold, a little congestion? Are you about to have a flu, or this is COVID that is mild or moderate or severe? So that's going to increase number of people that will be coming to care, medical care, emergency care for all kinds of issues related to a viral illness. And it is up to us to figure out whether it's the flu, other viruses, or COVID-19.
Is there a specific symptom difference between the flu and COVID-19?
Unfortunately, just on the face of it, it's very hard to distinguish them all because they all can cause a fever. They all can cause sore throat. They all can cause congestion. They can cause cough. Less likely with COVID, the cough is going to be with phlegm. It's usually a dry, hacking cough. But, often, there is variations in people who are presenting with different other viruses. It can cause. Now, diarrhea, it's another illness. It's another symptom of different viral infections. Can happen with COVID too. Can happen with flu too. Body aches can happen with all three. So just listening to the story is going to be very hard to distinguish. Unless we have very low rates in Connecticut, then we would suspect that one is more likely than the other. We would maybe, if we see that the flu activity is increasing, that at some point we will probably consider flu diagnosis higher than COVID. But knowing what's happening around the country and having people still travel in and out of the state, bringing the potential for transmission in the state as well, and specifically being in a different kind of temperature zone come fall and winter, we are looking at some definitely uptake of viral illnesses. We're hoping that the COVID-19 is not going to be back to where it was last spring. But there are multiple prediction models that potentially can look at a huge second wave versus a mild second wave and just a routine sort of not very severe season. Well, we hope that it's not going to be severe for all of us.
Will that second wave, if it does come, even if it's a moderate second wave, combined with a severe flu season, are we up against something that we've never seen before?
Yes. So as you know, during the flu seasons, we increase our admissions to the hospital. There are many more people out of work because of the illness. But now you multiply that by the possibility of COVID and the risk of hospitalization on top of having just the COVID itself. But in case there is a flu outbreak, it's going to be a burden on the hospitals to make sure that these patients are cared for well. So we continue to stress the importance of social distancing and masking, especially in the upcoming flu season, because that will definitely protect you against the flu and will decrease the risk of COVID. So there is a double benefit of using the masks.
It seems like that the first wave that came kind of prepared us a little bit better. So are we in good shape should a second wave happen? Do you think we have we're better prepared and better to deal with it? We can anticipate the hospitalization rates and how to treat patients?
We definitely know now much more than we did back in the springtime. We now we understand the disease better. We know when the best treatment has to be done. We know the treatment options. As you all heard, there is this drug called remdesivir that many hospitals in the States, including our hospital, has it in our possession for patients with COVID. We know how to recognize patients earlier. We know that there are other manifestations of the COVID which are very unique, like stroke, for example, maybe just manifestation of the COVID, or a clot in the lungs, maybe manifestation of the COVID. There are also role of steroids that very recently was highlighted, but we've been using it for several months now, even before the study came out. So we now know how to take care of those patients. Unfortunately, even, let's say, even with the influenza or COVID, you may be doing everything right, but the patient, because of certain illness problems or age or both, or the time when he or she comes to the hospital, may still be in danger of losing their life. So that will not change, but we are much more comfortable understanding how to triage the patients, treat the patients, isolate the patients, protect other patients and staff, protect visitors, protect public if this were to happen.
Are you concerned at the time of this recording that we're doing now? We've seen neighboring states such as Rhode Island, which we have not seen before, now being in that zone of travel restrictions. How concerned are you that this is kind of closing in on Connecticut? Do you think that this is going to be a problem?
I am concerned, but I think that our local residents really got the message correct. I think more than any other state, as far as I'm concerned, we are using social distancing. We are masking. Our workplaces are doing the right thing to make sure that we unload the workplace, that we don't have people sitting next to each other or not wearing masks. We are making changes to our restaurant policies. We are screening all the incomer patients in the hospital for COVID. So I think we're in a very good place to make sure we can avoid the real big hit, even if the neighboring states are having a rise in the cases. Now, because this virus is very contagious, you can have local outbreaks, but if the majority of the population continue to follow those rules, we can have contained outbreaks rather than a really full-on hot spot again all over the state. I really cautiously optimistic that this is not happening to us and will not happen to us.
You're listening to Healthline. Our guest today is Dr. Alina Filozov from Middlesex Health. And let me ask you a little bit, Doctor, about how this virus is transmitted. People thought for a while that surfaces were the big thing. In the early stages, we were told you don't need a mask. That kind of have evolved because this is a new virus. What can you tell us? Are we going to continue? You mentioned social distancing, wearing the mask. How long do you see that happening?
Until we have an effective vaccine, I don't see that we are going to be out of the woods. And it's not just a development of the vaccine, but also distribution of the vaccine and also seeing the vaccine being effective, hopefully, at least several months out. So I personally don't think that we're going to be out of those rules until next summer. So I think this is really until we see that we at least have a season where people who are vaccinated, we're wearing the masks and we're still protected. I don't see that earlier than early summer.
And one of the changes we've seen over the last few months is that in the beginning it was thought that young people are almost immune to this. It's not the case, and that might be driving the uptick, if you will, in number of new cases.
So this is not a new concept that young people have the disease but don't have it as bad as older. We all know diseases, for example, mono, right? Mono, if you're 18 years old, you don't feel good for a couple of weeks. Sometimes, certain unfortunate people have it a little bit longer. But if you were to get it as an adult, you'll remember it for the rest of your life. And the story is multiple other viruses. So this is the story of COVID. Young people, for the most part, have a milder illness but they still have the same amount of virus. So if that same amount of virus is going to be affecting somebody who is 80 years old, for example, which is considered to be high-risk group, then they will have a very different outcome than somebody who just had a little sniffle and maybe a little cough and maybe a little fever in the young people. And I don't want to underestimate the presentation of the disease in the young people. As we know, there are deaths associated with COVID-19, but I want to remind everyone that there are deaths associated with flu as well. So any viral illness can be risky and can cause inflammation in the body, which COVID is very masterful doing in young people, but most so in older people. And that's where the mortality or death issue comes with related to COVID. It's not the virus itself. It's what our immune system does as a result of the virus and going overboard, really causing that kind of a disease.
And once somebody's infected, how long does it take for symptoms to develop? We talked about the symptoms early in the program. How long does it take to manifest those symptoms?
So the incubation period is about 2 to 14 days. So that means that if I was exposed to COVID today, I may not have any symptoms for several days. But that does not mean that I cannot transmit the virus. So let's say if I tomorrow were to get a fever and start coughing, today I'm still presenting a problem to somebody who is around me if I'm not wearing a mask or not maintaining the social distance.
And that's the rationale behind the quarantine when somebody comes from one of the hotspot states of 2 weeks.
That's correct.
If somebody does come down with COVID-19, they get over it, they're fine, can they get it again?
There is a debate about that right now. There is no evidence right now that somebody who's had COVID and generally in fairly good shape, even if they have other illnesses, will get it again at least for the next 3 months, because the data shows that our antibodies persist for at least 3 months. So I think this would be a safe kind of area, but there are some people who are so severely immunocompromised and take steroids for whatever illnesses they have, or they had very prolonged illness in the hospital. They may not develop a very good immune response, so they may be at risk for recurrence.
I've also heard that some people with different blood types can be affected in different ways. Is there any truth to that?
So they seem to think that people with type A share a gene that is coding for the same receptor that COVID is using. So people seem to think that type A blood type predisposes you to actually developing a much more severe infection. But the opposite is true too. If you have another type, you're not immune to COVID. Mm-hmm. So don't think that if you had type B, type 2, or type O, that you are immune. As a matter of fact, in our hospital, because we type cross multiple patients, the majority of people, we actually type O.
And we can probably do a whole show on the misinformation and disinformation.
Yes.
But that's another show.
Mm-hmm.
But let me ask you, what is Middlesex Hospital doing as far as testing and other community interventions as far as COVID-19 goes? So
we are back on providing full range of care that we did before COVID. All the patients are tested for COVID. All patients are required to wear a mask for their protection and staff protection. All staff is wearing a mask at all times. There is a limitation on visiting patients. In the outpatient setting or in the offices, doctor's offices, we ask not to have visitor unless it's related to disability of the patient, or there is no way to around it, because we sit in tight quarters in the exam rooms and we want to make sure everybody's safe. So that's another issue. Now we have options of testing people even before surgery.
And if people want more information about COVID-19 and or the flu,
you can go to middlesexhealth.org and there will be a page on COVID-19.
Dr. Alina Filozov, thank you for being our guest today in Healthline. Healthline is produced by the Community Health Education section of the Middletown Health Department, which is solely responsible for its content. Please join us again next month at this time for another edition of Healthline.